Whether you're a clerk or a waiter, an accountant or a doctor, your health matters.
Hello and welcome to Your Health Matters Let's Talk. Now, Your Health Matters Let's Talk is a monthly discussion program focusing on priority health issues affecting us in our day-to-day lives. On this episode, we are discussing the youth, HIV and drug abuse. Help me welcome my guests on the program. Mr. Pearson Chilema is from the Drug Enforcement Commission and he's a counselor. Welcome to the program, sir. And we have Mr. George Tafuna. He's the head psychiatric, social and legal services at Chainama Hills Hospital. Welcome to the program.
Thank you.
Thank you. Now, before we go into the main program, here is a profile of a young person that was lured into alcohol and drug abuse and how they came out of the web. So let's have a look at this.
When we look at the problem of drugs and alcohol, it is a very, very big problem in Zambia. Now, most times a lot of people tend to underestimate the problem. In terms of alcohol, it is because it is a legitimate drug. As long as someone is 18 years and above, as long as they have money, they'll be able to drink whatever alcohol they want.
I would like you to share with me.
My story began introduced by my cousin about the drug, about this heroin and marijuana. When I used to take that, it affected a lot. Sometimes it used to make me lose appetite. I wasn't eating. I wasn't sleeping well. Your health is just come where you don't bath. Maybe for a long time you won't bath, you won't change your clothes, you look scruffy. I wasn't realizing what was going through, but the other people who were not taking it were seeing me that I'm not going in the right way. So they tried to tell me that, no, you're not going in the right way. I used not to believe them. It took me almost 2 years to 3 years. Yeah. Then when I came to realize that no, this thing is not good, then I need some help. So I had to change. Then my mother said, okay, there's a place where we are going to go, have the counseling, and then change for the better. I think I'm doing well. But for the other people, what I can say is that drugs is not good.
When the first day banshitire nokunshitira banandi na mwana akolwa nandi sanfa bwino sana kwa dukshana kuposha abantu shani fida then kachero kakaena na ngwine fe obwadwe yo in first day kachero kakaena na shite umfafe umuntu wefidia umuntu wakaripaka ipana mkube baine guys sinimvira mushe so and then basanji bacha nyangova so kumwa muna bumbi futi na isangwa mwa paka ndebelera kai bare nkoseresha afuna shiresa nkwacha na isa kosa nomba nalisaba addicted ku nankani ku kuli alcohol as well as asata mpoko yuzinga kono tufaka tufaka twini so na isaba addicted yakutira nganshi wamfeshe fide ma substance mumbili mwandi share chita function bwino so manje yakutira tinshire bomba tapare fonde chita ila ngatwamba wada bataba umyabakulu bare kufaya ko abakweti nangfaba rumendo nabakatempiana I'm going to give you so much wakana konomba na samunapo ndaifi yanko sera indefo kula kolwaliyo sinokula fibo mfyefinto ofuna chitire join meshi na sex week so nali kala munshite tali muni ni chito then early 2008 ero kwa shire isaba abata sinta inshiturimu street ku North Mid bati barechita recruit ama-sex workers so basatu bapa program yabwe yatasinta shanshani. First time nalisaakana ya number 2 ero bansangire futi cockpit abantu bamo bene. First day na join kutasinta ero kwaishireisa na aba shops aba alcohol and drug banda chibafa ko bana mayo ama alcoholics naba bumshana ma drugs. Then after na bwera na shireta mpokubira ko kutasinta since kareko banchitire recruitero aba basanse nda kutasinta sata mpokubira ko tufya kufwala in 20 the same year 2008 basanchita ko invite kuya ku Brazil kuchita attend a third World Congress against the sexual exploitation of children and adolescents. So I was the only youth from Zambia. I represented Zambia as well as Africa ku Rio.
As SHABs, our programs are based on public health, approach, where we go out and talk to these children about the dangers of substances. I'm not just talking about alcohol, but I'm also talking about these other drugs like heroin, cocaine, marijuana, and other, drugs that these youths are misusing. Now, if they're already there, we should find a way of managing them. Again, we come in. This is why we have group kind of counseling. This is why we have individual counseling. Drugs like heroin, marijuana, especially marijuana, and also cocaine. These drugs have also been abused so much in Zambia. Now, we don't have good statistics because you'd find that most of the research that is conducted, it is very difficult to talk to the actual people that have been, taking these substances because, most of these drugs are illegal drugs.
People will say alcohol is a stimulant. When actually, when you're taking alcohol, you're going all the way down to your comatose stage. You've heard of people that will tell you, I blacked out. It simply means you went into a coma, which in other ways, you were half dead.
As Africa Directions, we thought, why don't we have a place where young people can come through and play pool and play basketball and play netball and, do boxing. If you go in Mtendere, for instance, or any other place, where can you find just even a simple pool table? You can't find it anywhere. So you find that a pool table can only be found in bars. As a result, young people that would feel they would want to play pool, they can only go in bars. And when they go to bars, just specifically to go and play pool, that's where they start, abusing alcohol because that's a place where people drink from. We give recreational facilities to the young people, but we also couple up recreational facilities with information on SRHR, that is sexual reproductive health and rights. And we also give information and we help young people that are abusing alcohol and substance abuse. We have a lot of success stories where young people from the community, they've come, actually, we can talk even people like Esther Perry, the famous boxer. She came from Africa Directions.
Thank you. That was a clip on how HIV, drug abuse, and alcohol abuse are all just interrelated. Let me start with you, Mr. Chilema. How serious is the problem of drug abuse among young people in Zambia?
Thank you for that question. I'll answer it this way. That from just a general survey, when you look around and you go in these bars and these drinking places, you find that most of the people, the customers who are entertained in those places are the youth. But when you look at it from the drug point of view, let me give you a simple statistics. You find that in 2009, we had 225 youth, young people, who came for counseling at Drug Enforcement Commission. In 2010, we had 273. In 2011, we had 291. In 2012, we had 340. That's just a small institution. But when you look at, again, you break through this, you find that out of the 340, 8 were adults. That means what number does it give you? To give you 332 young people. Again, you go further, that out of that number, you are going to find that the people who are abusing are starting from, the age range is from 12 to 25. But when it comes to 12 to 19, you're going to find that there are 202 young people who came for counseling. And this already will show you that, of course, the number should be, there is an increase. We find that most of these young people who have got drug problems, they go even to churches. And we don't receive those statistics. So you can see that the number is real high. One thing which is there again, if you look at the statistics from just a simple observation, single parenting, I think, has become a challenge in our country. Most of the children who are abusing drugs are those who are coming from single parenting.
Mr. Tafuna, at what point can you tell that this person is now abusing alcohol or drugs?
If we look at alcohol itself, if it is a lady, she's only supposed to take 14 bottles of castle in a week. If it is a gent, he's supposed to take only 21 bottles in a week. And those should be alternative. Maybe you take some drink on Monday, on Tuesday you rest, on Wednesday, just like that. But you'll find that our youth, every day, they are sleeping in pubs. That simply means that one is abusing alcohol.
So how can a family know that their child is taking intoxicating substances that can make them be at high risk of getting infected with the HIV virus?
First thing is that every parent should regard his children or her children as his friends or her friends. The people they are going to share with, the people who they are going to know very well. And even when the son or the daughter is going off what is the norms of the family, he is supposed to know that I think there is something fishy in this particular situation. So one thing which is going to happen that the child is going to change. The behavior which is known by the family might not be the one which the child is going to carry on with. This child, if he goes to school, the performance at school are going to be poor. And that's why it is important and imperative among parents that even when your child comes back from school, take keen interest to know how that child is performing. This child who was not maybe wearing strong perfumes, from nowhere, he starts applying a lot of perfumes to disguise the substances, the smell of the substances. Sometimes the child who was not even putting on glasses or whatever, he starts putting on sunglasses inappropriately. Even when there's no sun, he's putting on sunglasses. Why is the child doing that? The child is trying to disguise the red eyes.
There's also the issue of the eating habit. You find that the eating habit will change. If you leave the relish in the fridge or in the kitchen, this child will be busy now going around and eating everything. And then also these children become violent at homes. Find that a young chap just does something, he will beat, he will insult other people, just like that.
So how does drugs and the abuse of alcohol put a person at risk of acquiring HIV?
You know, when you talk about drugs, you're going to talk about crime. You're going to talk about sex. Now, when you have got impaired judgment, what happens? That means even the things which you in a normal you are going to see as if they are risks, but when you take the substance, they are no longer risks. You can still relate with them or indulge in them. And when you do that, that means you are going to be exposing yourself to the risks of having the acquiring HIV infections.
I've noticed that parents are really coming out prominent here. Mr. Tafuna, could you just go through what parents are supposed to do to prevent the abuse of alcohol and drugs? What type of information are they supposed to share with their children?
The parents should look at guiding their children, like now, to become associated to one of the behavior change institutions, of which one of them is the church. If the family encourages the children to comply with their churches, if I say the church, I don't mean Christianity, I don't mean what, I mean everyone, maybe a Muslim, maybe a Christian, all of them, they have got morals that they follow. So parents should make sure their children abide by that.
So let me say one observation I've noted is that if in the home parents drink, it's most likely the children will copy because they will take them as their role models. So whatever they do, they are also going to do. And the culture now which has come that you can keep alcohol in your home, in your fridge and what have you, when you are not there, the children can taste so that they also understand how you feel when you have taken the substance.
Well, gentlemen, thank you so much for sharing with us this valuable information. I must say that the information that you brought out is really thought-provoking, not only for me, but also for my audience, isn't it? Yes. Let me see those with questions. Thank you so much. Let's start with, yes, behind.
HIV/AIDS is a serious health problem among youths. What programs are available to educate in prevention?
There are so many programs that are there to educate the young ones about HIV and AIDS. We have connected HIV and AIDS together with the alcohol and substances because these things are interconnected. So we have got what we're calling community awareness programs. Then we also have school debate programs where we float in questions in schools and schools have to choose, and then we reward them at the end of every session. In such, we encourage children to get a lot of knowledge out of it. Because even in homes, there are pupils and young ones who watch these programs. Then there's the media campaigns, and most of the youth are calling on their phone-in programs. So they are calling and they are having on-spot answers.
Well, thank you very much. Let's get some more hands. Let me see some more hands. I'm trying to be so gender sensitive here. Okay, I'll pick the lady at the back.
Can you elaborate on how alcohol and drug abuse can affect one's judgment and how it can lead to domestic violence, accidents, and the risk of HIV infection?
Would you like to take that one, Mr. Chilema?
Thank you. When somebody has taken alcohol, I think it should be Mr. Tafna who mentioned that a person becomes violent. They become argumentative. They become something which is not normally there. And in that case, even when the madam at home is saying a good thing which might be a polite way of responding to a husband, the husband might interpret it or misinterpret it and then react negatively. So these are the things which we find. And because of this, we have found a lot of fights in the home, not even amongst the husband and the wife, even the children are being abused because the mother is drunk, the children have to do everything which is required. Now, in terms of accidents, this is the same thing. You misjudge the other vehicle which is coming. You are off, you are not in control of the whole thing. And especially if you have added alcohol and cannabis, it becomes worse. Okay? And you can't know who is, and that's why in most cases people say, take yourself to be normal when you're on the road. The rest of the people, don't take them to be normal because you don't know what can happen at any time. When it comes to the risk of HIV, I think we have talked about it. You might have all the knowledge, but because of the alcohol you have taken, you miss everything. You forget everything. Your memory is affected, and you can't remember a thing. And you only realize when you have finished whatever. Say, did I use this thing? And it is too late, because you might be infected at the end of the day.
Thank you very much. Let's have some more hands, please. The next question.
What health services are available to support the young people who are HIV positive?
The young ones, usually they are scared of going to see adults. So we have programs where we have put in friendly corners, where the youths are the ones who are running these corners in order to encourage others. And then we have got community support programs, where we encourage communities to have groupings. Then there are also other supportive services which are educating on behavior change, like the NGOs. Most of them, they have got behavior change programs, like the Youth Alive. So all those are programs that are bringing in the young ones so that they can not feel isolated and stigmatized.
Well, this topic is really, really interesting, and I have a youth audience, so I expect more questions from the audience. Let me see the hands of those with questions. Thank you so much. The lady at the back.
Thank you. What are some of the reasons why young people engage in drug and alcohol abuse?
Some children involve themselves in drugs because of curiosity. They want to feel how others are feeling. Others have indulged in drugs because of the peer pressure. They want to belong. They want a group. They want to appear as with the rest. Other children are because of their role models who are doing it. The other people are getting the drugs because of ignorance. They don't know the implication at the end of the day. It is easy to go into drugs, but it's very difficult to come out of them. The other thing which is there, which will make other people to go into drugs, they are forced by others. So some people is that because the environment, everyone is taking it. Why not me?
Thank you. So I think the message is really, really clear. If you want to be a role model, at least be a good role model. Let's continue getting some questions. Thank you. The gentleman there in the front row, yes. Thank you. Please go ahead.
Thank you. I want to find out, how can I deal with a young person who is on drugs and alcohol abuse? Thank you.
Let us love them. Let us not stigmatize them. Because when we stigmatize them, our attitude of helping might not be there. Because if we don't do that, they might think ill of themselves. They could be the people who can kill themselves because they are thinking everyone is laughing at them. But of course, we should also be quick to realize that some of them, they give themselves self-stigma, which is very difficult to deal with. But let us encourage them that they are valuable, they are important people, especially those who have got families or who are at school. That's why they are supported to go to school, is because we respect them and we like them to achieve, just like the rest of the people.
Well, Mr. Pearson Chilema from the Drug Enforcement Commission and Mr. George Tafuna, the head psychiatric, social and legal services from Chainama Hills Hospital, would like to thank you so much for making an appearance on Your Health Matters. Let's Talk. Thank you so much. And to the audience, thank you so much. You've been fantastic. Give yourselves another round of applause. You've been really, really fantastic. Thank you so much. And to the viewers at home who would like to interact with you, please feel free to ask any question on any of the issues that we've discussed here and previous programs. You can get in touch with us via our Facebook page, www.facebook.com/MOH Zambia. This is Your Health Matters. Until next month at the same time, God bless you.